All right, one of the issues that will likely come up today is something that was maybe a gift for Governor Pence, and that is no less than Bill Clinton last night at this time commenting on Obamacare, the Affordable Care Act, that he all but said wasn't quite affordable. I want you to listen to Bill Clinton talking about the president's health care program. Listen.
You've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
Now, what he was acknowledging was some of the problems with Obamacare. He wasn't trashing it, but he readily acknowledged the problems. Someone at the campaign must have gone to him today because he dialed that back, talking about it at Ohio University in Athens, Ohio today. Listen to Bill Clinton a day later.
Look, the Affordable Care Act did a world of good. And the 50-something efforts to repeal it that the Republicans have staged were a terrible mistake. We, for the first time in our history, at least, are providing insurance to more than 90% of our people.
All right, well, it's now a Democratic Colorado Governor, John Hickenlooper. Governor, thanks for taking the time. Do you think somebody got to President Clinton to sort of ease up on this?
No, I doubt it. He probably just saw the press and thought it over. I mean, certainly the challenges with health care have been there for a long time. Just escalating costs, no real control. You know, before the Affordable Care Act, 80% of all the hospitals and 90% of the doctors in the country did all their medical records, all their prescriptions on paper. It was a horrible system. It's obviously been, the transition's been more expensive than anybody would like.
All right, but you know, you get the stories in the Washington Post, the New York Times, kind of saying, look, they've got to adjust this thing because the premium increase for the tens of millions of more Americans who are supporting these millions more have been added to the system is much more onerous than was originally thought to be the case. How do you think Democrats should respond to this, since this was passed without a single Republican vote?
Well, I think that, and everybody predicted it was going to need work. And certainly we've had problems with things like, you know, people with pre-existing or suddenly they get a crisis in their health care and they're not on a plan. They suddenly go on the plan, and they have a right to go on the plan now, and they get very expensive treatment. And then as soon as they're out of the hospital, they go off the plan. And that's happened at enough times, so that is putting a disproportionate level of cost on the rest of us. Now, what the solution is there, you know, we're working on that, and I think we'll figure it out. But when you're trying to expand health care so that everybody's got at least a little minimum care, and that people can't be thrown off a health care plan because suddenly they get sick, they get cancer or some serious illness, I mean, that's changing the system in a big way, and it's going to take some work to get it to really function. There are not that many people that want to throw the thing completely out.
But do you think, I know what you're getting at, Governor, I see your point, but do you think that if people had known how much their premiums would skyrocket, the support would have been there for this?
Well, if you look at the rate of increase of their premiums over the last 20 years, they haven't skyrocketed. They've gone up a little bit more than previously, but they have certainly not skyrocketed when you look over the totality of the years since implementation. I don't think it's going to be a big issue in the debate.
The average premium has gone up around 54%. Now, that might be for higher, more inclusive premiums. You quite rightly talk about the millions more of health insurance than ever did, a meritorious goal. But was it worth that much extra, and to recognize all the extra work that has to be done for this?
Well, so that's averaging, what's that averaging, about 10% a year? That's over 5 years, right? Is that how you're measuring that?
Since its inception.
I think that's right, maybe 6 years. So the average
kind of
premiums were increasing, they were increasing 8 to 10% before. And that's what I'm saying. We were in a terrible place before. No one remembers that. So they're still going up. We have not bent down the cost curve.
It just sounds like a swap out to me. You know, sir, it just sounds like a swap out to me. So 8 to 10%, 8 to 10%. You know?
Right. Certainly, the part of the goal was that by expanding, make sure everyone had basic health care and the people weren't going to the emergency room, that would cut down overall on the cost. And I think it's still well. We just haven't. We still got problems we have not figured out how to address.
All right. Thank you, Governor. We know you have a busy schedule. We very much appreciate you taking the time.